Good evening. Thanks for joining us tonight. We begin tonight's newscast updating a developing story out of Washington. President Trump tweeting just minutes ago that he's visiting Walter Reed Medical Center to see his wife, Melania.
First Lady is recovering from kidney surgery. According to her office, she was having an issue with her kidney and was treated for a benign condition. She's expected to remain at Walter Reed outside Washington for several days. Action 2 News has learned Oshkosh police are conducting a death investigation regarding a former patient at Winnebago Mental Health Institute in Oshkosh.
It happened back in October at the psychiatric facility run by the Wisconsin Department of Health Services. It is the same facility Target 2 Investigates told you about last fall, where employees told us that forced overtime and dozens of staff vacancies were affecting their work and patient care.
Sarah Thompson's been on this story for the last 5 months, filing open records requests and talking with state officials and investigators. She's here now with what she's uncovered. Sarah.
Well, Bill and Cammie, we found there are at least 2 cases of patient care called into question by state regulators, which back in January found the facility was subject to termination from the Medicare program for non-compliance. It said the deficiencies were significant and limited its ability to render adequate care. Now, one of those cases involves a patient who hit his head but wasn't sent to the hospital for 13 hours, requiring surgery for bleeding on the brain. Oshkosh police detectives tell Target 2 that man died at the hospital 17 days after the fall. They're now working with the Winnebago County District Attorney to determine if a crime was committed. State regulators made a surprise visit to Winnebago Mental Health in December over concerns for patient safety. Target 2 Investigates received their detailed reports through open records requests, finding October 14th last year, a patient was admitted to Winnebago Mental Health Institute and intentionally fell and hit his head on the last fall to the floor. That was around 10 a.m. A nursing report says the man slept all shift after the fall without responding to verbal stimuli. The report shows neurochecks were not started until 11:10 p.m., more than 12 hours later. It says the man was lying on the floor in the day room, having wet himself earlier that evening, but wasn't moved to his room for approximately 2 hours, though no time was specifically documented. When investigators asked why, at least 2 employees told them they didn't have the staff to do that. The report, though, found the unit was staffed per protocol that day. According to this report, the man was transferred to the emergency department at a hospital sometime the day after he fell. Oshkosh police confirmed to Target 2 that man died at the hospital. Through open records requests, Target 2 found this email from the new acting director of Winnebago Mental Health saying 2 nurses were referred to the licensing board as a result of the matter involving the death. Target 2 has not found any disciplinary actions taken against the nurses or doctor involved in this investigation. We also found a second case being investigated involving a suicidal patient being released despite that patient telling staff she still had suicidal thoughts and intended to jump out of her father's vehicle on the way home and take a bunch of pills. Investigators found on the way home that night, when stopping for gas, the woman ran onto a highway and needed to be physically restrained. When asked if this was the first time for releasing a patient who still had suicidal thoughts, the doctor told investigators, "No, we do it all the time. It's a judgment call. We believe the patient had a hidden agenda to be suicidal. If I had to do the whole thing over again, the only thing I would have done differently is to tell them to have 2 people in the car driving home." Because of these cases, investigators ordered Winnebago Mental Health immediately correct the problems. Target 2 found the facility agreed to more training to deal with staffing issues and patient falls. And in a statement to Target 2, the Department of Health Services, which oversees Winnebago, said, quote, "The well-being of our patients and staff is our highest priority," adding that Winnebago welcomes outside reviews of its operations to provide assessments and guidance to identify and correct deficiencies and strengthen services. And regulators say the facility's Medicare contract will be terminated in July if the problems are not fixed. We will keep an eye on that and report those details to you. But all of this happened right after the state brought in an independent consulting firm to look at staffing and overtime at Winnebago, and it recommended numerous changes. We'll have that part of our investigation tonight at 10.
Sarah, thank you. Look forward to it.
Action 2 News at 10 starts now.
Good evening. Thanks for joining us tonight. Changes must be made at Winnebago Mental Health for the safety of patients and staff. That's the finding of an independent review of Winnebago Mental Health Institute in Oshkosh.
And this comes amid a patient death investigation that we first told you about on Action 2 News at 5. Oshkosh police tell Target 2 investigates a man fell and hit his head last October, but wasn't taken to the hospital until more than 13 hours after the fall. Police tell us he died at the hospital 17 days later. Investigators and the Winnebago County District Attorney's Office are now working to determine if criminal charges are necessary. That investigation is one of several factors threatening the facility's Medicare funding. A death investigation began after a consulting firm was brought in to study the work environment at the state-run psychiatric facility. Target 2 investigates uncovered major problems there last fall when staff came to us exhausted and stressed from working repeated overtime. Now consultants are backing up their claims and urging change. Sarah Thompson has been following this for months, talking with employees and pouring through open records requests. She joins us with her findings and what's driving these problems.
This is the 74-page report just released by the Department of Health Services to Target 2. It's the review we told you was happening last fall, and now we're getting our first look at the incredibly detailed and very matter-of-fact findings, suggesting an overhaul of the work environment at Winnebago Mental Health Institute. One line sums up the entire report. The current state is not sustainable and will impact the ability of Winnebago Mental Health to meet its mission, vision, guiding principles, and values. The review team spent 12 weeks interviewing staff and analyzing every step of their daily work. Bottom line, more patients and not enough staff.
People are tired. People are mentally drained, physically drained.
The overtime is crazy.
We talked to 4 employees in our first stories last fall. One had just resigned because of overtime. The other 3 were not sure they'd last. Only one is still there. The others tell Target 2 they've since left because of working conditions. The consultants from Cerner Group received similar responses during employee interviews, finding they are very focused on helping patients, but when it comes to feelings about work environment, some staff reported feeling demoralized, discouraged, and disengaged. One of the reasons, forced overtime. This report finds nearly $1.9 million spent on OT in 1 year. The biggest group affected, psychiatric care technicians, or PCTs, the employees who came to Target 2 last fall. This report shows PCTs worked a combined 50,000 hours of overtime in that year, far more than other nurses and nurse practitioners. The review firm estimates hiring 22 people for those positions would reduce overtime to 2% of hours worked and save nearly $500,000 in taxpayer money. That savings would be more than $1 million if Winnebago kept employees, showing a 32% turnover rate among PCTs through August of last year. But retaining and hiring may not be so easy. In several prior investigations, Target 2 has found a growing shortage of mental health providers. This report calls the outlook of available psychiatrists in the next decade dismal, blaming burnout, aging doctors, and low pay in the public sector. And the list grows.
I think some of the change that has made it bad is the Act 10 from Governor Walker.
Countless employees have told Target 2 Act 10, which ended most collective bargaining for most public workers, is part of the problem in finding staff to work at Winnebago. This independent review lists it as an impact, the first time we've seen Act 10 documented as a factor in employment. It's all compounded by a change DHS made 4 years ago, shifting more long-term patients to Mendota in Dane County and short-term ones to Winnebago, where state law says no patient can be turned away. While the consultants found some changes already underway, like contracting outside staff and expanding community-based services, it finds more needs to be done. It suggests better recruitment and retention, like tax-free loan repayment assistance, hiring more nurse practitioners or physician assistants, the only area of the medical field expected to grow in the next 7 years. It also suggests learning how to spot staff fatigue and developing a mentoring program to help keep staff. What will change remains to be seen. DHS again declined our request for an interview, but in a statement said it's using the report to make, quote, informed decisions to accommodate patient needs and ensure staff have what they need to provide care. We have that full statement and this complete report at WBAY.com.